Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thanks for joining us. President Trump says the federal government will not extend its social distancing guidelines. They expire on Friday. In the Oval Office earlier, the president said the Stop the Spread guidelines would be, quote, fading out. He attributed it to the work governors across the nation are doing.
And I think a way of saying it, they'll be fading out because now the governors are doing it. I've had many calls from governors, Governor of Texas, Greg Abbott, and many governors, Tennessee, Arkansas. We're speaking to a lot of different people, and they're explaining what they're doing, and I am very much in favor of what they're doing. They're getting it going, and we're opening our country again.
Meanwhile, the president is once again facing questions about testing capacity in the U.S. During an event at the White House Tuesday, he claimed the country will soon be conducting 5 million tests per day.
You're confident you can surpass 5 million tests per day?
Oh, well, we're going to be there very soon. If you look at the numbers, it could be that we're getting very close. I mean, I don't have the exact numbers. We would have had them if you asked me the same question a little while ago, because people with the statistics were there. We're going to be there very soon. We're really doing a great job on testing.
The president appeared to walk back those comments Wednesday. Here's his response when asked about testing by our CBS News White House correspondent Ben Tracy.
On testing yesterday, you said that we will very soon be testing 5 million people.
Well, I don't know where it came up.
Yeah, you said that.
I'd like to refer to these two people because I don't know where it came up. Everyone kept saying, you said there'd be 5. That was a study that came out. Somebody came out with a study of 5 million people. Do I think we will? I think we will, but I never said it. We're testing millions of people. We're testing more people than any country in the world by far, by double, by much more than double.
You were asking,
and they said 5 million.
We'll be there very
well, we
soon.
will be there, but I didn't say it. I mean, I didn't say it, but somebody came out with a report saying 5 million. It sounds like a lot. Yesterday, I looked at Deborah. I said, what's with the 5 million? I think that was from the Harvard report. But we are going to be there at a certain point. We'll be there, but we're more advanced than any country in the world on testing.
During that meeting in the Oval Office, Dr. Anthony Fauci also made an announcement about a potential treatment for the coronavirus. He said a trial of the drug remdesivir is showing promise in hospitalized COVID-19 patients.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. Because what it is proven is that a drug can block this virus. And I'll give you an example in a moment of why we think, looking forward, this is very optimistic. The mortality rate trended towards being better in the sense of less deaths in the remdesivir group. 8% versus 11% in the placebo group. It has not yet reached statistical significance, but the data needs to be further analyzed. But we think it's really opening the door to the fact that we now have the capability of treating, and I can guarantee you, as more people, more companies, more investigators get involved, it's going to get better and better.
Anita Kumar joins me now. She's a White House correspondent and associate editor for Politico. Anita, good to see you. Let's start with the president's comments on the Stop the Spread guidelines. We heard him praise governors who are beginning to reopen their states. Are the expiration of these guidelines and the president's comments designed to put more pressure on governors?
I think that all of his comments lately have been designed to put that pressure on governors. But look, this is really sort of what the governors have been doing. While the guidelines have been out there, each state has decided for themselves what they wanted to do, what those orders would be. And so I think the governors are continuing to do that. So from their perspective, not a lot has changed because those orders were already there. But, we're seeing some governors extend stays and we're seeing other governors start to open up. So I think what you're going to see across the country is the continuation of this patchwork of orders where Americans are doing very different things right now. But, he doesn't want to extend that. He wants to put that pressure on the governors to make these decisions.
Well, we also heard the president try to walk back comments he made Tuesday about the U.S. being able to perform 5 million tests per day. Do his health advisors believe that's actually possible at this point? And if not, why is the president making those claims?
Well, that's a good question. I mean, he did seem to indicate from that audio that was played that he did say that 5 million. What this number is about is people saying that 5 million tests per day need to be conducted in order to open up the country again. So clearly, as you know, the president has been talking for weeks now about opening up the country, and he feels very strongly that we need to get there. And so he wants to show that everything that needs to be done is being done. But you're right when you asked about these health advisors. Some are saying, no, we are not going to be there right away. Maybe eventually, but he's talking about opening up the country now in these next few days and weeks. And it does not look like the U.S. will be on track to have 5 million tests a day, as many people have said are needed.
Right. Well, Anita, the White House is urging states to follow the federal reopening guidelines, yet the Justice Department says it may sue states that are too restrictive with their stay-at-home orders. So is that contradictory messaging here from the administration on when and how states should reopen?
We have heard contradictory messages from the president and the White House for weeks with the governors. You know, if you'll remember, a couple weeks ago, the president had said that he has the final authority on whether states should reopen or not, and that it wasn't, it was all up to him. And if you'll recall, legal experts said, well, actually, the president doesn't have that authority. It's not there in the Constitution. The states actually have the authority. But I think there's been a lot of back and forth here. The president wants to do everything he can to push the states to reopen. We know that. He's been talking about that for weeks. And I think this is another mechanism to sort of prod them along and say, look, we're watching you. It is up to you. We know it's up to you, but we're watching you, and we're going to see what you're doing. And if it's too slow or you're lagging, then we're gonna take notice. And so I think the governors are seeing that. I've seen a lot of governors push back, though, and say, look, we're going to have to do what we need to do for our states, and we'll deal with those consequences if there are any.
Right. I mean, there's such variation, right, in some of these states. In just one state alone, you could have a widely sort of rural, wide open kind of area, and then not that far away have an urban area where the health concerns could be very different. Well, President Trump also singled out the World Health Organization on Wednesday. He said they, quote unquote, misled the U.S., and he called them, quote, literally a pipe organ for China. Why is the president continuing to go after the WHO?
You know, he's, as you mentioned, he's been doing this for a while, and this is part of his strategy to really blame China and say, the Chinese government did not stop the outbreak, did not warn others. If you'll remember, the president stopped U.S. funding to the WHO, which is a significant portion of its budget. The Democrats on Capitol Hill say that's that he can't do that unilaterally. So there's some debate about that. But this has been part of his message for weeks now, maybe even months, where he has decided the more criticism he's faced, the more he's really criticized China and, also the WHO for what he says not doing enough. He believes that, the Chinese only send a smaller portion to the WHO for that budget, and that the U.S. sends much more, and that they should have been looking out. Now, the WHO says they were looking out for things, but they can only do as much information as they had. Remember, China didn't let people into the country to look at what the outbreak was like, to examine things. And there are a lot of people that are blaming China, but they're also saying that there are a lot of things that the Trump administration could have done to help this even after it got here, with the tests, as we just talked about, with medical supplies. And so, they're saying that there's blame to go around.
Well, finally, I want to ask about comments made by Senate Majority Leader Mitch McConnell. During an interview earlier this week, he said there will probably be another funding package to aid state and local governments. Now, he's faced some criticism for suggesting that some states should declare bankruptcy. Is this an attempt to put those remarks behind him?
It is. I mean, he's acknowledging that that he's willing to go forward, but there were two caveats. One, he said that infrastructure would not be part of this package, or he didn't want it to be. If you'll recall, the president has said he wants it to be. So there's one issue there. But the biggest issue right now is he's talking about how he wants some protection for companies so that they don't, face these liabilities, these lawsuits if workers go back to work and they get sick with coronavirus or there are deaths. He wants the companies to face, to have some protections from those lawsuits. You heard the House Speaker, Nancy Pelosi, saying today, though, that she does not think that is the right way to go. She doesn't want to protect businesses. She wants to protect those workers. So right now, that's a big divide between the Democrats and the Republicans on this next, on this next bill, and it's unclear sort of where that's going to go now.
Yeah, we'll be watching that closely. Anita Kumar for us. Anita, thank you very much.
Sure. Thank you.